Arizona Capital Times Morning Scoop. You're here with us, and we thank you for that. And I'm Gary Grotto, the executive editor of the Arizona Capital Times. And today we're going to discuss public policy of postpartum health care, what the state and legislature proposed to do to improve it, and what the future holds for it. The Arizona legislature is currently considering SB 1272, which proposes to earmark nearly $9 million to expand Medicaid coverage for up to a year for eligible new mothers. Arizona is the latest of several states, more than half the nation, to take up this expansion to improve postpartum health care. But we wouldn't be here today, though, to have this important discussion without our sponsors. I want to thank Children's Action Alliance and the Arizona Public Health Association. The mission of CAC is to be an independent voice that identifies and eliminates barriers to the well-being of children and families and creates opportunities through partnerships and policy solutions. The nonprofit, nonpartisan research, education, and advocacy organization was founded in 1988. Our second sponsor, the Arizona Public Health Association, is a nonprofit professional organization working to improve the health of Arizona communities through advocacy, education, and professional development. We couldn't do these morning scoops without busy people willing to carve out some time to sit as panelists. Our first panelist is Senator Tyler Pace, who represents Legislative District 25 in Mesa. Senator Pace is an entrepreneur and has served in the Arizona Senate since 2019. Good morning, Senator.
Good morning. Thank you for having me.
And Senator Pace is joined by a fellow legislator from the other side of the courtyard, Representative Jennifer Germain, who represents Legislative District 18 in Chandler. Representative Germain also started her service in the legislature in 2019. She also she has a long history in the advocacy and nonprofit sector spanning several states. In Arizona, she's worked for the Alliance of Arizona Nonprofits, the Brain Injury Alliance, League of Women Voters, and Arizona List, and a lot more than that. So thank you for joining us, Representative Germain.
Thank you for having me. And just a little bit of a correction, I've volunteered as an advocate for all of those organizations. I have not been an employee.
Okay, gotcha. So thank you for that. We also have Dr. Sarah Selleck. She's been the Chief Medical Officer for the Arizona Healthcare Cost Containment System, or as it's known by everybody here, ACCESS, since June 2014. Dr. Selleck leads the agency's major clinical initiatives and oversees the quality of delivery of the healthcare services ACCESS provides. I'm glad you could join us, Dr. Selleck.
Thanks so much for having me. Good morning.
Good morning. And our fourth panelist, Dr. Gagandeep Singh, is the Chief Medical Officer for Mercy Care. Before that, Dr. Singh was the Chief Medical Officer for Behavioral Health for Banner Health. Dr. Singh is a patient-centered physician leader and educator with 20 years of experience in high-quality clinical care and impacting populations of patients. Thank you for being here, Dr. Singh.
Thank you so much. Great to be here.
Thanks. And before we launch into the discussion, I'd like to ask our audience to, please submit questions via the chat line. Your participation adds, an extra layer, an extra dimension to this. And, you have questions that I probably couldn't think of. So please send them our way. So let's start the discussion with Dr. Selleck. So what's the current law when it comes to Medicaid's postpartum health care? What kinds of things are covered?
Yeah, thanks so much, Gary. So we're really fortunate to have a robust benefit package for 60 days once the pregnancy ends, so postpartum coverage. And with this proposed bill, and thanks to the leadership of Representative Germain as well as Senator Pace, we're looking to expand that coverage to 12 months once the pregnancy ends. So postpartum coverage up to 12 months. And so that would have a pretty significant impact as we've been working with Department of Health Services here in Arizona, and also just monitoring what's going on in the national landscape around maternal morbidity and mortality, whether that be due to a medical condition such as diabetes, diabetes, gestational diabetes, or secondary to a mental health condition such as depression or substance use condition. And so, really expanding that coverage from 60 days postpartum to 12 months postpartum, as afforded through the ARPA plan at the federal level, based on amendments to the Social Security Act, can have a really profound impact in regards to our Arizona Medicaid population, because we cover about half the births in Arizona through Medicaid. And so we have a very significant footprint for postpartum care, both from a policy perspective as well as a practice perspective. And so I'm happy to go a little bit more into detail in regard to what that looks like. But basically, our current postpartum coverage is pretty expansive in regards to both acute physical health services coverage as well as behavioral health services coverage up to that 60 days postpartum. And then this bill, again, based on the allotments through the ARPA, as well as our leadership down at the state legislature, would expand that up to 12 months postpartum.
And who's eligible for this?
Yeah, and so it would be, as far as eligibility categories, there are different eligibility categories for Medicaid. One of those is our pregnancy category. And so the pregnancy category is defined just like that, just as simple as that, is that an individual is pregnant. But I did want to note there are other eligibility categories for Medicaid, including we are a expansion state, which brought on the Affordable Care Act. That expansion population of what was previously referred to as our childless adult population, individuals living at or near poverty up to 133% of the federal poverty level. And so, thanks to the leadership of then Governor Jan Brewer, we were able to expand Medicaid to Arizona and include additional coverage for individuals outside of the pregnancy category.
But the eligibility actually expands the number of pregnant women that can join Medicaid, right? Or be covered under Medicaid, because it's up to 150%, right?
Yeah, and so I think what you're getting at, Gary, is absolutely the fact that basically those individuals that are covered under the pregnancy category would basically get that expanded coverage up to 12 months, whereas they would have dropped off after 60 days, because there are different, as you alluded to, different income eligibility brackets based on eligibility category. So this would, in essence, expand Medicaid coverage, because you're going from that 60 days postpartum period to the 12 months postpartum period. Okay.
Well, thank you, Dr. Selleck. So, Dr. Singh, can you just explain for our audience, how Mercy Care fits into the Medicaid system and how you help new moms?
Sure, thank you. So first of all, Mercy Care, we're a local not-for-profit Medicaid managed care plan. We've been serving Access members in Arizona since 1985. We currently provide access benefits to almost 500,000 people across the state. That includes people with special needs. So we provide a slew of physical health, behavioral health services, including pregnancy services for Medicaid eligible Arizonians. I'm here in part because it's women's health is a big area of focus for us. And as Dr. We've alluded to previously, about 50% of Arizona deliveries are under the Access umbrella. For us personally at Mercy Care, about a quarter of our members are in the childbearing age, and we serve about 6,700 deliveries a year. What we know is that about 3,000 women drop off the Access rolls each year in the postpartum period at 60 days. What that means is some of the women that Dr. Salek referred to that are really high risk, women with maybe delivery complications, gestational hypertension, gestational diabetes, women with depression, they cannot get the service anymore that they really require for a longer period of time to make sure they're healthy and fine. We are here to make sure we can continue to serve that population. Part of what we provide as our services is really the full range of services that Access covers. So we provide the prenatal care, the delivery services coverage, postpartum care. One of the other areas I should highlight is that several of our members end up being higher risk members. So for them, we provide significant care management services, which is where one of our employees is really working with that member to help them navigate the difficult healthcare delivery system to make sure they can get the right care at the right time at the right place. And that's really crucial in our mind. And then beyond the regular care, we are really embedded in the community. And what that means is we provide grant funding to several local organizations to improve maternal health. So that might be things like Let's Talk, which is a program run by the Dignity Health Foundation that provides perinatal mood disorder therapy services, sessions for 60 mothers, and they've shown significant improvements, or a program called Patina program through Native American Connections, which is a 45-day program that provides substance use and co-occurring mental health treatment for women in the postpartum period, along with childcare for their kids up to 5 years. And they've served about 157 members since 2021. So direct care, but also participate in the community to improve maternal mental health and physical health care.
Where do the women who, their time is up, where do they go? If you've got just, the diabetes and, other health issues, where do you go after Medicaid is you're no longer eligible for Medicaid?
That's really where the difficulty lies.
Mm-hmm.
And to some extent, potentially Dr. Salik might have a better answer than me. I think some of them, so not everybody loses their eligibility at that 60-day mark. So the good news is the way eligibility goes for Access, several people can still retain their eligibility based on other criteria. Some of these persons, when they lose their eligibility, might still get eligibility through the ACA, perhaps. So that might be the other group. But the big fear is that several of these people, these 3,000 people that drop off the rolls each year from Access, end up becoming uninsured or significantly underinsured. And the fear from our perspective is these are the people that are only going to show up in healthcare in the time of crisis, when it's going to be really expensive to take care of them. And more importantly, where their lives and their families' lives have been really severely affected.
So thank you, Dr. Singh. Senator Pace, I saw the initial hearing for this bill, and you told a personal story that's kind of behind your sponsoring this. And can you share that with us and tell us what the bill does?
Gary, thank you. There are many personal stories behind why I'm an advocate for this and have been an advocate for maternal health as well as child health. But the story that I shared, I was fortunate enough that when I have 3 children, my first child, he was born, we were on Medicaid. We were actually on Mercy Care. So thank you, Dr. Singh, for being here. What a wonderful program to be a part of. And we were on that. And when my child was born, he was born healthy, and my wife had a safe delivery. And when 60 days came by and she was discharged from that, we then went uninsured. And our second child, we were using a different form. We were using a different type of insurance than our third one. But unfortunately for us, when my wife did have complications postpartum, we had coverage that continued on, both physical health as well as mental health coverage for what she needed. I have many family members, and I think everyone who is watching knows an individual who has had a postpartum complication. That's the reality of why this bill is necessary. I think the big portion here is to realize that maternal health extends way beyond just giving birth to a child. We spend a lot of time acknowledging that when a woman becomes pregnant, she needs healthcare coverage for a safe delivery of a child. But the optics and the way that we formed this by saying 60 days later, you're good to go home. It's kind of like that when you have your first child and you go to the hospital and they make you watch this video, about taking your child home for the first time. And then they make sure you buckle your kid into the car seat correctly. And then they wave you goodbye. And you go home and you get home and you say, where's the manual? How do I raise my child? You're learning for the first time. Imagine being in that experience where you're learning to take care of your child for the first time. You're a single mom, or you're a young couple, or you have health issues. Could you imagine the complications that come when you're thrust into this new world of becoming a parent and you're sick, or you're having thoughts that you've never had before and you don't know why you're having them? This is a reality of what it's like to be a mom in Arizona and around the world. So changing the narrative that we say healthcare coverage for moms doesn't end at 60 days. And I would love to extend it even further, but a year is a great example. We are giving coverage for the child for a year. Mom needs to be going to the doctor and have that access too. And what Dr. Singh said, which is very important, a lot of these individuals don't seek medical help until there is a problem. We want to encourage the preventative routine care to identify things before they become a problem, and therefore making sure that we have continual coverage is best. A lot of people have told me, they say, well, Senator Pace, these individuals could quit their jobs and then they'd go on Medicaid. Well, we don't want them to quit their jobs, right? We don't want them to take demotions to qualify for Medicaid. Or they'll tell me, they say, well, if they go to the hospital and they have a really big bill anyways, Medicaid will pick it up. Why would you need to expand it? Because we don't want them to end up going to the hospital for a big bill. We want that continual, constant care. I think about it when a woman gives birth to this child, there's a whole list of things that they need to do with their child. They say, okay, you need to go to your 1 month follow-up. You need to go to your 2 month follow-up. You need to go to this. And at 1 year, you need to have these follow-ups. How great would it be for mom to have that conversation with her pediatrician about her child, and then have that same conversation with her provider that says, Mom, you need to come in and you need to see me. Let's walk and talk you through these things. Mental health coverage. Postpartum depression is real, and it is one of the more serious side effects. But then we have those who have uncontrolled diabetes due to pregnancy, hypertension due to pregnancy, to have that consistent care coverage. So I am beyond excited about this bill. I think this is one of the greatest things. And I will just say one last thing, that Representative Germain has, and many others have been very integral to this part. This is not just a Senator Pace thing. I happen to have the bill that's going through and be the one that has my name next to it. But this is a work of art and passion from hundreds of individuals across this state and nation, and I'm grateful for all of them.
Thank you, Senator Pace. Representative Germain, you had a similar piece of legislation in the House this year. And, you mentioned beforehand that this bill has been introduced like the last 4 years. So why is it important to keep these women covered?
Yeah, thank you, Gary, and thank you to Senator Pace for all of your work getting this through this year. This is something that has been a passion project of mine. This is something that was a passion project of former Senator Heather Carter. When we, as a woman, as a mother who has had 2 very complex pregnancies, resulting in the birth of 1 healthy child and the loss of 1 child. Postpartum care is so vital to the continuum. and not just those women who go home with a happy, healthy baby, but those women who their babies suffer in the NICU, those women who go home empty-handed. We need to make sure that we're continuing this continuum of care for all pregnant people, and for all people who give birth to a baby, and all those people who go home empty-handed from a hospital. And especially when we're looking at maternal mental health. Prior to the pandemic, 1 in 5 mothers suffered from a mental health issue during their postpartum care. And during the pandemic, that number spiked to 1 in 3. And for those of us who went through pregnancy, who went through loss during the pandemic, it is even further compounded. So making sure that we're wrapping our society and our community in the support that they need to get through difficult times is one of the fundamental basics that our government should be doing, and to make sure that we're extending this coverage to each and every person. And I know here within the Phoenix Valley, with the closure of the birthing center at Phoenix Indian Medical Center, we really want to thank Congressman Ruben Gallego and Kim Russell over at the American Indian Advisory Council for Healthcare, working to get Medicaid waivers for those women to give birth at other hospitals here in the local valley. So making sure that it's not just those who qualify under the fiscal aspect of Medicaid, but making sure that we're wrapping those who have the waivers from other systems to be able to use the Medicaid services to extend postpartum care.
So we had a prep call on Friday, and I don't recall who said it, but or maybe I saw it in the hearing that I watched with Senator Pace. But somebody mentioned that this is kind of a life and death thing, and they gave some statistics that 50% of deaths occur 12 weeks postpartum to 1 year, and 85% of those deaths are preventable. Can somebody talk about that and how this is gonna help that?
Sure, I'm happy to take that if you like. So according to the Arizona Maternal Mental Health Mortality Surveillance, there's about 70 women who die each year during the prenatal and the postpartum period. And as you mentioned, about 50% of these deaths happen beyond the 43-day mark, so between 43 days and 365 days. About half of a significant number of the deaths are preventable. When you look at the overall number of pregnancy-associated deaths between 2016 and 2018, the thought from the same source is that about half of these deaths were related to mental health conditions or substance use conditions. So whether it's suicide, overdose, other conditions, and the vast majority of those deaths then are preventable, things that we can really take action for. And when we're thinking about especially mental health and substance use care, it really is not something you do. It's not a one and done sort of deal. It's where really having that continued coverage can be really beneficial in really taking care of the person. And that's where, as you said, I think some of this is not just improving healthcare, but it's also about saving lives.
Is the the substance abuse, is that self-medicating because of the mental health issues? Is it just piling on? Piling on?
Yeah. So substance use is kind of complex. I often tell people it just depends person to person. There are times when we might go out and use a substance because we just want to experience it, or because we want to get high, and there might be times when we're using it to try and cover something up. And then there's learned behavior and genetics that come into play. And some of us, it takes forever to get addicted, and some of us are addicted at hello. And it just depends upon kind of how we made up. And so and ultimately, addiction then will take a life of its own because it just captures the brain pathways associated with reward and becomes its own problem. So certainly there might be some people where they're self-medicating and that's how it starts, but it's a significant issue in of itself.
Dr. Sella, can you talk a little bit about, the behavioral health aspect of postpartum care?
Yeah, and as I mentioned earlier, and I know Dr. Singh had also kind of alluded to, through Medicaid, we offer a very robust package here in Arizona related to behavioral health care that includes both mental health, such as postpartum depression, as well as substance use conditions such as opioid use disorder. And we cover the full continuum of care, whether that be preventative. As Senator Pace said, we really want to try to prevent the onset of conditions if at all possible, whether that be physical or behavioral, and then early intervention in regards to identifying if an individual, for example, has postpartum depression or is struggling with a substance use, and then also treatment. And so that treatment can look like anywhere from outpatient services, which we can leverage telehealth for, such as, counseling or therapy. It can include intensive outpatient, partial hospitalization, inpatient treatment. So we cover that full continuum of care. The other thing I wanted to note, and I know Dr. Singh had mentioned this, and you had also asked, Gary, what about those individuals that no longer qualify for Medicaid? And so what is the safety net we have? And so one of the things through the Health and Human Services at the federal level, SAMHSA, which is the Substance Abuse Mental Health Services Administration, SAMHSA has grants. And one of those grants is a block grant, and it's called the Substance Abuse Block Grant. And individuals that are, postpartum, for example, no longer qualify, let's say it's 12 months, because we're keeping our fingers crossed that 12 months postpartum coverage will actually pass, and we'll get that for Arizona. But let's just say it's that post that 12 months postpartum coverage, that there is a safety net in regards to federal block grants to make sure that we are able to provide services for individuals with behavioral health conditions, whether that be substance use under a substance abuse block grant or serious mental illness under a mental health block grant. And so that would be for individuals that are under or uninsured, for example, that drop off Medicaid. The only other thing I wanted to mention is we're very fortunate that the past legislative session, we had a bill passed that required us to form the Maternal Mental Health Advisory Committee, which I currently chair. And we've got a great cross-dimensional group of experts that are helping advise. And we have a report due to the legislature with recommendations in December of this year. Some of the findings that we're seeing come out of recommendations, including, some of the concerns around access to care, connecting to care earlier, and again, really that preventative care during pregnancy, is around expanding the reach of our current healthcare system, which obviously coming off, the last 2 years of the pandemic has been stretched really thin. So looking at really innovative ways and not new ways, but really innovative ways of coverage, including certain services that we don't currently reimburse for through Medicaid. And so one of the recommendations coming through is going to be around doula coverage, community health work coverage, so that we can reach into communities and have those community experts reach into local, families and make sure that they're educated around all the different healthcare services they have access to, including through Medicaid or through our block grants.
I'm just going to take a quick question from the audience. Is transportation to appointments covered?
Yeah, so I'll take that. We are very fortunate in Arizona Medicaid to cover non-emergency medical transportation. It's called NEMT. And so absolutely, we do cover transportation to medical appointments here in Arizona through Medicaid.
Great, thank you. Senator Pace, it always comes down to funding. How's it funded?
So yeah, I one of the rules that I always have with any bill is where's the money, right? Whenever something comes across our desk, we always think about that. So this one, there are several different ways to fund this program that we've decided to run through the legislature. And before session began, we reviewed all those options. Obviously, the simplest option is we fully fund this with state dollars, as we have full control over that. However, the way that is designed, it doesn't take advantage of some federal drop-down money that is available to us. So this program, there is a general fund appropriation, as you mentioned earlier. I believe there's a 2.7 and then a 7 that ongoing that would fund this, and then we would use, as was mentioned earlier, through the ARPA and different creative programs, receive the federal drop-down funds through a recapitalization with permission from CMS to expand our program to offer these. What that essentially does is it puts state money on the table as a promise that we're going to carry our end of the deal, and that Medicare is going to, or CMS is going to fund the rest of our program to get the full total package. I don't have the numbers in front of me. If we did this all on our own, of course, this would be much more expensive than that 7 mil ongoing that we were talking about. So this way is by far the most creative, cost-effective way to do it. It also does rely on the fact that we have to petition the federal government to allow us to expand our program to do this. However, my understanding, and I know we're getting some nods, is this is looking very positive with CMS allowing us to do these funds. And hopefully this will set an example for other states to be able to do the exact same thing.
So, the bill is just sitting in the House right now. And I assume that's because of the budget negotiations, because there's, you guys are still working on the budget, and it's an appropriation. Do you know where it stands right now, Representative?
Thank you so much, Gary. And I do know that it is in the budget negotiations right now. It's in the draft. So hopefully it will make it through the final version. And that's going to be, Senator Pace is going to be doing the heavy lifting on that to make sure it stays in the final version. And we really hope that this is the year that we fully expand postpartum care to 1 year.
Gary, might I answer that just a bit too? That's okay.
Yeah, no, go ahead. No,
I'm sorry. I just wanted to get permission from the moderator.
No, you don't need my permission.
Oh, thank you. So yes, this is part of the budget negotiations. Anytime we have money tied specifically to something, unless there is a specific deadline that it needs to pass, like the I-10 expansion, we have some stuff that needs to be done by, of course, mid-May. So we have to expedite that. Anytime we expedite something beyond the budget that has money to it, it has to be approved by everybody. It's a very rare situation. So this bill, 1272, is linked to the budget. I was having budget negotiations with the governor, the speaker, and the president on this bill long before session began, and was very positive. I explained to them that for me, every year I pick one thing to do in healthcare for us to better the lives of Arizonans. Last year, the thing that I did was the newborn screening expansion. That was my number one thing I looked for on the budget. Of course, I look for, return on investment projects, universities, a lot of these other great things in education, but we as legislators all pick kind of one thing that we want to champion. And maternal health coverage up to 12 months is my topic and my thing. Every budget negotiation I've had, that's the very first words that come out of my mouth is, where's that funding? Show me the line item. Oh, it's right there. Okay, good. That's what I'm looking for. And it's gotten to a point where, of course, with budget negotiations, where when we have those, the very first thing they say is, it's on there. Don't worry. So, it's all about making sure that we work our members and work the budget. This passed out of the Senate with incredible support. It's gone through committees with great support. You even saw in health, we saw members of the health committee who never voted for something with money on it. And I'll do a shout out to Representative Chaplik. Representative Chaplik never votes for anything that has money on it in committee, because he says it's only part of the budget. And he voted for this because it is such a critical thing for Arizona. So what I'll tell you is those who are concerned about whether this bill is moving or not, this bill, the governor's not going to sign 1272. It's just, he's going to sign a budget that has 1272 baked right into it. That's going to guarantee this funding for these moms and help better the lives of Arizonans.
And as Representative Germain mentioned, this bill has gone through, it's been introduced, the last 4 years. Why now? Why, and it's getting a lot of press nationally, or at least the idea of expanding the Medicaid for postpartum care. It's getting a lot of press. What turned the tide?
Yeah, I really think that the pandemic had a lot to do with turning the tide, and the fact that our society now is more keen to talking about mental health care issues and talking about preventative health care and talking about making sure that we are continuing care, the care continuum for the entire society. And I just think that everything aligned, and this is the year that this has become our champion issue.
And I think you mentioned earlier, like some statistics about how, I guess, see here, that things worsened in the pandemic. I mean, you had a statistic. I don't recall what it is exactly, but
1 to 5 to 1 to 3.
Yeah.
Yeah. Okay.
Yeah. And part of that is the isolation of the pandemic, the loss of community support. When I had my first child, we were able to get wraparound services at our hospital and be able to have in-person parenting classes and be able to visit a doctor in person where they can look at you and go, okay, and what about your mental health? What are you doing to make sure that you are maintaining your health as a mother? And during the pandemic, all of that kind of just stopped. Mm-hmm. And then we saw a snowballing effect where the isolation and the threat of disease, we still do not have a COVID vaccine for children under 5. And that weighs very heavily on the minds of parents.
All right. So I have a question from the audience. And anybody can take this, I guess. What do you view as the biggest priority for 2023 and beyond when it comes to promoting pregnancy and postpartum health? Dr. Zalik.
Yeah, that is a great question. I think when it comes to, maternal health globally, it's going to be changing the tide in regards to what we're seeing in the United States and Arizona related to, mortality as the most extreme outcome. And so we do know that our populations, our African-American population, as well as our Indigenous Native population is at higher risk of, poor outcomes when it comes to that postpartum period. And so from my perspective, it really is making an impact where we're seeing disparities for that postpartum period. And again, the most untoward outcome, the most extreme outcome being mortality. And so the way that we do that is collectively, and it's not a one size fits all approach. And we've been discussing it at length through our maternal mental health advisory committee. And taking into consideration, women want services locally that are culturally representative of what is important to them. And so providing those services in their home and community, including the expansion of coverage to community health workers, to doulas, to connect women to culturally respectful care is the cornerstone. And so I would say as far as amongst the priorities, it's making sure we're putting our efforts where we're seeing the most need. And that would be in regard to our populations most impacted by poor maternal mental health outcomes. Or I should say poor maternal outcomes, including mental health.
Okay. And
Gary, I would just love to chime in about 2023, if that's all right.
Yeah.
So, Dr. Salek, thank you. You covered 99%. That 1% that I wanted to add in there is the thing that we need to do in 2023 and beyond is to stop siloing healthcare. We often, as policymakers, we take healthcare and we break it up into little pockets, and we say, you get this, but you don't get this. Obviously we're breaking down that barrier between physical health and mental health. But for decades, we ignored mental health as part of the care of a mother. But we do the same thing with dental care, right? Well, I find it so fascinating that if you had a wound on your hand and your doctor saw you and said, oh, that's the hand, I don't deal with the hand, that's not covered. But when the wound is in the mouth, or you have an infection in the mouth, or you're having pain, which is causing you to suffer, or dental pain can lead to a lot of other things, as well as we talk about, the disease, oral disease can lead to preterm labor, but we just ignore the mouth. I find that fascinating. We ignored the brain, we ignored the mouth, and we focused on the belly. So in 2023 and beyond, it's to expand what healthcare is for moms, and to understand that healthy babies and healthy moms doesn't start at the second trimester. It doesn't start or end at the third trimester. It starts before they even get pregnant. And to realize that, prenatal care all the way to postnatal care, to postpartum care, and a full breadth of coverages for that. So I think the focus is just remembering that, we often try to solve one thing, and we can only solve one thing at a time. But I was telling someone yesterday, whenever anyone in my family or friends tells me they're pregnant, the very first thing I do is I give them 2-year supply of prenatal vitamins. That's my gift to them, because they're expensive. And now I own a medical supply company, so they're not expensive for me, but they're expensive for people. And it's often a cost issue that prevents them from investing in their health. I don't want any mother in Arizona to be worried about investing in their health. And so hopefully that's what we can focus on as the years go on. So thank you, Gary.
Thank you. And we're getting a lot of hallelujahs from the audience. I think everybody can see the comments in the chat. And Representative Germain, I know you've got other postpartum issues that you wanted to talk about, and one of them I think was dental. You've got a bill about dental care.
Yeah, I do. I have a bill that would expand dental care to women at the moment that they determine that they're pregnant.
Okay.
But also we need to, as a legislature, as a community, have broader discussions on the complexity. Pregnancy is a complex medical situation. And really, our legislature needs to get out of our doctors' offices and let our doctors manage complex medical situations. And in addition to that, I also have a bill for paid family and medical leave, which if we're looking at this as a society and we want to retain employees and have them return to work after the birth of a child, we need to have that support that comes with paid family and medical leave.
All right. Thank you.
And that can be done very easily through the use of short-term disability insurance. It doesn't need to be a big expense for the employers. It does not need to be a big expense for our state.
Thank you, Representative. Dr. Singh, how would you work with your provider networks on, getting the word out to the members about the extended coverage, and, how would you work with your OBGYNs and the care network?
Sure. So, that everything we do ultimately is all the care we cover is provided by our provider network. And so we have a large team that's really dedicated to having that conversation. I know I go out and meet several of our provider groups. One of the ways we certainly share kind of big changes is through webinars such as this, where we might bring on a big slew of groups to talk about. We have regular mailings to them. We have annual meetings with our provider groups. We have a provider handbook that's easily accessible to them that tells them exactly what they need. But above all, a lot of this happens individual to individual as well. So we've got a team of provider relations reps who go out and speak with the provider groups to make sure they're aware of what coverage is available.
So thank you, Dr. Singh. Somebody mentioned that, we didn't cover health or mental health or even consider it a problem in postpartum. What changed about that we started acknowledging it, and not only acknowledging it, but now we're doing something about
it? I think part of that is, as Representative Germain mentioned, we've just had a bigger sight on it, perhaps with the pandemic. So I think that's one of the few good things that has come out of the pandemic, right? Is as we were all stressed, we all talked about it some, and when we have people like Senator Pace, Representative Germain, and all of us talking about it, I think that really helps further that discussion. Yes, we are all under increased stress, and that does increase the rates of people that are struggling with significant mental health issues. But this is not new. We've had mental health issues all this time, and it's always been a factor. We are recognizing that it really takes an impact on not only the quality of the healthcare for that person, but really has a huge impact on society in terms of cost, but also quality of what we all live. But I'll defer it to others on this.
Yeah, I'm happy to weigh in as well in regards to, what's changed in regards to why are we more comfortable as a society talking about, mental health. And I think it's a multitude of factors, including wonderful advocacy organizations that are really fighting against stigma. And so historically, there has been a lot of stigma around having a mental health or substance use condition. So I might be comfortable talking about my asthma as an individual accessing care or diabetes, but I'm not comfortable talking about depression or anxiety or alcohol. And so just normalizing that as part of a normative conversation, not making it any different than having a physical health condition. And I think it's really a society change, a societal change in regards to not blaming the individual, but really reaching out our hand and providing help to the individual. So I think in the past, we oftentimes blame the individual for bringing that upon themselves. And now I think we're at a much more sophisticated time where we recognize that, mental health and substance use is part of a complex, as Dr. Singh mentioned earlier, a complex biopsychosocial model that fits also within the physical health realm. So, and I agree with what Senator Pace had said earlier. I'm always, perplexed by kind of this division of the body and mind. Both Dr. Singh and I are psychiatrists and have worked within the field and have seen, and worked within those silos. And so really have taken a very concerted effort, including through our Medicaid system here, to integrate services, both physical and behavioral health services. And so thanks to the leadership of then Director Tom Betlach and now Director Jamie Snyder, we've integrated services for individuals, both behavioral as well as physical health services. I think there is still a need, and it goes back to adult coverage benefit for dental services that Senator Pace had alluded to, that we have a more limited coverage option for dental. That is a policy decision, but at the end of the day, and to kind of answer your question, I think our advocacy organizations such as NAMI, our Office of Individual and Family Affairs, have really done an amazing job to decrease stigma associated with mental health and substance use conditions. So we're very much more comfortable to talk about it.
Was there a time where, postpartum depression wasn't even recognized?
Yeah, I think in the recent decades, I think we've done a much better job of recognizing it. I think similar to all other conditions, when it came to behavioral health, there was a lot of unknowns, but now we know how depression presents postpartum. We know the tall tale signs. We know that there's screening for depression. We know that there's good treatment for depression. And so, yes, although there was a time in the past that we may have not recognized what that postpartum mom was going through, we now recognize it. We have experts also, and this is one of the other things I wanted to plug, through our Maternal Mental Health Advisory Committee, we're looking at bringing a Massachusetts model for access to those perinatal experts in mental health through what's called the Massachusetts Child and Adolescent Psychiatry Access Program, and it's specific to moms. And so there's kind of two models, but basically primary care providers, including OBGYNs, can tap into maternal child health experts in that natal partum period to basically gain knowledge of how to best serve a mom presenting with behavioral health concerns, whether that be mood, anxiety, psychosis. And so that is one of the ways that we're expanding access to care, is by bringing this model hopefully to Arizona.
One thing I thought of was, so the Mental Health Advisory Committee, how often do you meet? Can people tune in and watch a live stream of it? If they're tuning in now, they might tune into you.
Right. Yeah, no, I appreciate that. Yeah. So we do have a specific website with all of those meeting materials, Gary, and I can put it in the chat box as far as the link, including upcoming meetings, but we continue to meet both the major advisory committee, and we've got lots of different subcommittees working on several issues, including access to care, for example, working on how do we bring this Massachusetts model for specialty consultation to those experts that are far and few between. How do we leverage them through that Massachusetts model? And so, yes, I'll put the website in the link. So if folks want to tune in, they're more than welcome to.
Hey, Gary.
Yes, go ahead.
If I may add, so first of all, obviously, Dr. Salek, as with everything else, is doing an amazing job with chairing that advisory committee, and I'm really excited to see what comes out of that. One of the kind of when you asked about, hey, did we never ever recognize postpartum depression? I think part of it is there's this notion that pregnancy and then post-delivery is just a happy time. The reality is obviously not, and we definitely see lots of women who struggle with very significant mood and other symptoms in the postpartum period, as the body and the brain is going through a lot of changes. One of the big things I think is our OBGYNs and midwives and primary care teams, they're just doing a much better job of screening for this as well. So early on, we didn't screen for this. So the good news is our teams out there, they're doing a much better job of screening so that they can identify who's at need and then make sure they get the help they need.
Yeah, and Gary, if I may, there was a question in the box about ensuring that this focus continues, and that is exactly what Senate Bill 1272 will do in policy, is to continue this focus on postpartum care, including maternal mental health care, into perpetuity. So thank you to Senator Pace for devising this funding model, because this is what's going to carry us forward into perpetuity with this coverage.
Okay, well, that was going to be my next question. Are there any restrictions on this funding that, it's going to go away in 5 years or 10 years or anything like that? Senator Pace?
Yeah, no. So this would continue as an Arizona legacy. People can be, when it passes, I will say, and when it goes into effect, it will be as reliable as Medicaid, any other portion of Medicaid has been. Moms will know that if they qualify for Medicaid, they're within that, percentile, that they'll be guaranteed that coverage. And they won't have to be worried about being kicked off, or 5 years from now funding changes. As you saw, the support that we've had through this, through this chamber, both chambers, and as you'll see, the support for it as it goes onto the budget. I cannot imagine any legislative body, regardless of party that is in control, to make any changes to this as it goes into effect, because it will be so beneficial to moms. The one thing I do want to comment about, you have some wonderful, smart people here who have done a great job advocating for moms, and I'm grateful to be included in that group. Each of us bring a different set of skills. Obviously, my background's in healthcare, but one of my skills has been negotiating bills. I'm very confident in those areas, and so I feel honored to be a champion of a bill that we've been able to push through this chamber and push through the House. And each and every time a question comes up, we're there with an answer, and we're there with an army of support, and we're backing every mother in this state.
Great, thank you, Senator Pace. We got about 2 minutes left, and I just wanted to see if there were, any last thoughts from the panel. Dr. Selleck, would you like to help close it out?
Yeah, no, I just really am so appreciative to be part of this discussion. And, I see lots of thank yous, from the chat box. Just wanted to extend a thank you to, all of our healthcare providers that may be attending this. We so appreciate you. We couldn't do this without our healthcare providers. So that's how I wanted to end it.
Representative Germain?
Yes, to just echo Dr. Salek, thank you to our healthcare providers. Thank you to the families who came down to the legislature and shared your stories, because that is how we really move legislation, is by sharing personal stories. And thank you to Senator Pace for being such an amazing champion of this year. And a special thank you to former Senator Heather Carter, who was our original champion of this.
Thank you, Representative. And Dr. Singh, you get the last word.
Thank you. I just want to say a big thank you to Representative Germain and Senator Pace, first of all, for just advocating and talking about this, because this is so important. And I know Dr. Salek is going to be working at making sure we have a really great process to roll this out as well. So thank you for everything.
Great, thank you, Dr. Singh. So our hour's up, and it's time to conclude the program. And I want to thank our sponsors, the Children's Action Alliance and the Arizona Public Health Association. Also want to thank our panelists for being here at this hour. I know it's not terribly early, but it's still, you're very busy people, and it's early in the morning. And I want to thank our viewers. We didn't have our viewers, then we couldn't do this as well. So don't forget to tune in May 24th. We're going to discuss water, and we might even have another morning scoop before then. So, keep an eye on your inboxes, and everybody have a great day. Thank you.
Thank you.
Thank you.